So I want to welcome you to this session. Of course, you can see from the primary slide here, the session is on community-based collaboration, improving health outcomes in equity-seeking communities. I'll be one of your moderators here today, and I've already introduced myself. I'm Lucy Foreman. I'm joined by my colleague, Kim Farrell, and we will be your moderators / facilitators for this session. So for some quick housekeeping items, I want to draw your attention to the bottom of your screen. A lot of us are used to Zoom, but it's a good refresher anyway. So you can use the chat feature to submit your questions. Our presenters have graciously acknowledged that there are questions that come up during presentation. Feel free to raise your hand to have your question asked live in the presentation. We do have a limited number of times, so it might limit the amount of questions that can be asked during the presentation. So if you would like to use the chat feature to submit a question, we're asking that you start by typing a question in all caps in the chat before your question to make it easier for us to find them when we go through at the end. We will do our best to ask as many questions as we can during the time that we have. Please ensure your microphone does stay on mute until the Q&A portion of the session, unless you were coming off of mute when you're invited by one of the presenters. Please note that we are also recording the session to be able to upload to our conference website for future viewing by those who have registered. So you will be able to access this platform for 90 days following the conference. If our presenters have documents for you, we're going to be able to see those in the session page. There will be links on that page in the conference platform. We also kindly ask that you complete a short evaluation at the end of the session. Your feedback is actually really helpful and appreciated in informing future events such as this conference. And lastly, we would like to respectfully ask all of those attending today's session to engage with each other thoughtfully and always consider the impact of your words and interactions on others. So as moderators, we will not tolerate abusive or inappropriate behavior and will ensure that anyone who engages in such behavior is removed from this session. So I would like to now introduce our presenters for this session. Just checking this here, and I'm going to pin our presenters so that you will be able to see them throughout. So first we have Nasma Ashraf from Health Commons Solutions Lab.
Hello, everyone. Nice to meet you virtually.
Thank you. And we have Lydia-Joi Marshall from Health Commons Solutions Lab.
Good afternoon.
And Marsha Brown from Wellfort Community Health Services.
Hi, everyone.
And in the pin there, Janice Hemerding from CMHA Dufferin.
Hi, everyone. Pleasure being here.
Okay, thank you. And we're ready to go.
Thank you, Lucy. We're glad to be here virtually. I'm still, you'd think after 3 years we'd be used to this virtual environment, but it still feels like familiar but unfamiliar. So we ask, in the spirit of collaboration, that we make this a session united together. So just to introduce our topic, we're today speaking about community-based collaboration and how we improve health outcomes in equity-seeking communities. Some of it, when you signed up, you might have seen it listed as vulnerable communities. We'll explain later why we shift or we speak about it in different ways. It's all part of our learning and our explanations of what we mean by that. But we literally, as you heard, are a team from 3 different community health centers. And we wanted to present today to show how, what does that look like to best serve our diverse communities. So I'll let Nasma just start us off with an acknowledgement of where we are, and hopefully we'll get right into conversation and not a presentation.
Thank you, Lydia-Joi. So I wanted to begin by acknowledging the land in which we operate on. So for over 13,000 years, this land, which this presentation is taking place on currently, I'm located right now in Toronto, has been a home and traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And Toronto is currently covered by Treaty 13, which is signed with the Mississaugas of the Credit, and the Williams Treaties signed with multiple Mississaugas and Chippewa bands, and is part of the Dish with One Spoon Treaty territory. And as public health professionals who work in a field that is deeply rooted in colonial violence and broken treaties, we stand by the 94 calls of action from the Truth and Reconciliation Commission. And we also wanted to recognize that public health and research has not always been a universally positive experience for many communities, including First Nation, Métis, and Inuit communities due to settler colonialism. And so we stand in solidarity with First Nations, Métis, and Inuit nations in their fight for reparations, both locally and globally. And we wanted to call on to support the national inquiry into missing and murdered Indigenous women and girls. And following this land acknowledgement, I also wanted to input some resources. So we can go to the next slide. So these are some resources that you all can use to take action, which include reading about residential school history and reading on some educational resources for all age groups, and also listening to the Land Back podcast by Angela Sterrett, as well as learning about different online exhibits that are very easily accessible and are great teaching materials for people who are looking to learn more about the Truth and Reconciliation. So I've linked this, and in the presentation, you'll be able to access the links as well once we share it back with you all. And we can go next.
Thank you, Nasma. So as we said, today it's really about collaboration in so many different ways. So we're just going to give a brief introduction about the three agencies that are before you. Interesting, though, we're kind of representative of a larger collaborative. There's actually 17 different agencies that we were doing similar work supporting each other during the pandemic, which I'll speak a little bit about later. But want to give you a taste of why we're sitting here right now. Next slide. Kim, I feel like I should vogue or do something fun for the next slide instead of just say.
Please, that is amazing. Please do that.
Okay, so we'll do that and keep it interactive. So Nasma and I, we sit here from Health Common Solutions Lab. And so people often are kind of a little bit confused about what we do, but we are an innovation lab, which means that there's often different healthcare solutions that are rolled out within our community, specifically across Ontario, and we're funded partially by the Ministry of Health and Ontario Health, but other funders as well, to help look at solutions of how to implement those who are frontline workers and how, bring to capacity some of the things that they do. So most of our team, we have backgrounds in different aspects of equity, whether that's professionally or by lived experience. Many of us are within population health is what we study. And so we look at how those of our partners who are doing the work, I like to say, how we can support them. So we actually feel kind of humbly as just the support group here is what I would say that we are as part of this team. So maybe I'll pass it next to, I think it's the next slide, oh, sorry. To Janice to speak a little bit about what your organization does. Oh, Janice.
Sorry about that. Of course, I would be the first one to have this happen. As Lydia-Joi stated, we are one of 7 high community agencies in Peel, and all created around the pandemic. Our focus has been mental health and addictions. Of course, that has all changed to, in addition to mental health and support, mental health and addictions, we're doing wraparound support reports, and we're doing a lot of collaborations with partner agencies. And the key piece of this is, of course, our Hill Commons staff, Lydia-Joi and Nasma, who actually create for us the platform to train our CHAs to disseminate information and just ensure that we're all receiving the same information and could be spread into the community. So we are really positioned to speak with you regarding collaborative work. Thank you. I think it's Marsha next.
Hi, folks. So Wellfort Community Health Services is one of 70 plus community health centers across Ontario. We really do believe in the strength of our clients and the communities that we serve. We provide primary care services. So we have doctors and we have nurse practitioners and nurses. Both of our sites, we provide dental care, free dental care for eligible youth and seniors. We also have allied health. So we have a dietitian, we have clinical counselors, diabetes team, physiotherapist, and chiropodist. And then we also have our Bloom team, and they provide harm reduction services and support and care and treatment to anyone who's diagnosed with or at risk of HIV or hepatitis C. In addition to that, we have health promotion and education programs for seniors, women, youth, newcomers, and much more. But much of our work involves working really closely with our clients, local residents, and other partner agencies to ensure folks are able to access good quality care. Next slide. I don't know who's speaking to that one.
Thank you. Okay, so I said I would come back to, what is this high priority community strategy? We've all collectively, globally, just went through speaking it in past tense, which feels strange to speak about COVID in past tense, but the pandemic part of it, the acute part of it. And so at the beginning of it, our government decided we were looking at which communities did we feel were most likely to be impacted disproportionately by COVID. So hence when I said, we're looking at different ways that we speak to vulnerability, we don't mean that community is innately vulnerable. We're saying, were they vulnerable in this case? They were described as vulnerable to this pandemic more than other communities were. So this included, communities that we knew had higher rates of transmission, communities who were racialized and impacted by anti-racism because of that racialization, communities with material deprivation. And so these were things that we knew that they would be hit disproportionately by the pandemic. And so how could we support them in a way that we've seen in other areas? There were gaps, and we wanted to ensure that during the pandemic that we were at least addressing some basic concerns. So what we were funded, there were certain community health centers along with Health Commons that were funded to actually support a program that we would have ambassadors that could support their own communities through this time. So many services were closed down, so many services were shunted, so many were kind of brought back to bare minimum. But this was one program that we were actually able to expand and bring to capacity to meet these needs during that time. So what does this mean for us, and why did we think it was important to present this today? There's some lessons that we learned when we look at who was chosen as a high priority community, all of these things that we might do differently if we weren't in that acute phase. But we think the idea of the whole strategy and how we were saying, even though you might be supplying resources to everybody equally, is it really inclusive? Is it really equitable? And how do we ask these questions when we are delivering services to ensure that we are really co-designing services that impact those who we know time after time are disproportionately impacted? And so, for us, we would look and see, those who are already doing the frontline work, like our partners here, where do they not have time to be sitting and, writing strategies or recording what they've done, but it's an important part of it so that they're able to share the lessons with their peers. And so some of the things that we did was try and all mobilize together around how do we share our learnings of what's happening while it's happening in real time? Where are there tools that we can share together? And how do we really create like a repository that we don't feel like we're inventing over and over and over again the same solutions. These sound really basic, but we know, and I see so many healthcare workers here and so many centers here, that we know that sometimes when you're like in the height of a crisis, whether that's a global crisis or what's local to you, it feels like you have to sit and invent the solution from the beginning. And so part of our job was saying like that doesn't have to happen. This true sense of collaboration, that our resources can be amplified, was what was the most important. So that instead of resources being shunted into inventing new solutions over and over again, how do we figure it out, see what's working, tailor it appropriately, and scale that up? And so, this sense of that's how we can make sure that resources are appropriately used and designated effectively was really what made these collaborations be part of what we think is what healthcare, even justice, is, because we look at, how is it an appropriate use of resources? How is it an appropriate use of expertise and of people that maybe in the healthcare system historically wouldn't have been considered leaders or considered the experts. And we were able to come all together and say, well, this is the time where we have to value each of our contributions and we should do it quickly. So next. So we're going to show one example from our end, what we did of how we brought this together. And I think each of us, how we're going to present today is a specific example. There were many, and especially from our two partners here, there were so many things they did. They're very humble. I'm going to say that right now, like when I see what they're presenting today, there's a lot more that they did to serve their community, but we're using some examples of what it looked like. But one theme that ran through all of it was that we had community ambassadors who were the ones who led the work. So what we found was that before the pandemic, there's always this idea that there's very specific healthcare professionals with specific designations who are able to do the work. And we were able to lean instead on really valuing that who could really make a difference in disseminating information, in supporting people, in finding out the needs of their community are those from community. And that some of the technical skills is where we could band together to make sure they had that. So, maybe you weren't in conversations with people who wouldn't connect otherwise. This was something that we really looked at from community ambassadors. So what at each of the community health centers, it started initially with 17 groups and it did expand. What each group did, some already had community ambassadors, or some people call them peer workers, some community liaisons. There's been different terms, but we use this term specifically in the high priority community strategy. They were called community ambassadors. And what we did was we picked them from different areas. They were multidisciplinary, and we ensured that we had a community of practice in which they were able to really teach us what was it that they felt helped them serve their community during this time. We were able to come back from them to give to decision makers and policymakers and say, hey, these are the messages that are being rolled out, but this is how it's being received, and this is what might help better. And so, everything that we speak about today, it was really pivotal that it makes a difference to the people who were there, and the deep felt like compassion and connection that they had to the communities that they were in. Over and over again, we heard, even people who might not have had an healthcare background, the part and the empathy and the listening and the learning and the trust that they already had established actually sometimes overrode that. And their job was not to, clinically educate. It was to connect to appropriate resources. And we had to really trust them in saying what was appropriate and what was the right timing. And so, it's one thing that we really want to highlight when we speak about collaboration. This is also collaboration within community. So yes, it's between our agencies, but it's between those who we otherwise might not have had a voice in rolling out this type of program. So one of the things, was there a question?
Oh no, go on, Lydia-Joi.
One of the things that you'll hear us refer to a lot, I think, the reason why the community ambassadors were so successful was because our work is really based on, the social determinants of health, not only the clinical determinants. And I think, right now it's one of the buzzwords. I'm sure lots could answer in here. We always speak about it, but what did this mean in practice? And so for us, we knew that while there was this high priority community strategy, that is now being recognized as maybe being at more high risk for COVID, et cetera. Those conditions existed before. They were high priority, or they were made vulnerable because there were already existing prejudices, there were already existing oppressions. And so, we really like to stress the idea that the communities that we're serving, it's not because inherently they are disadvantaged. We know that there are systems that we are trying to address broader than just when this pandemic happens or when one thing happens. And so why it was so pivotal having the community ambassadors lead our work is because we were able to address that, and we were able to look at, okay, yes, we're looking at this crisis of COVID-19, but the community ambassadors were able to show us, well, we can't test or vaccinate or support people with that if they don't have food or housing, or they're experiencing racism when they go to a clinic. And so, the community ambassadors really helped us to navigate and look at what are important to the community that they serve, not just what's important to the greater mandate. And so we're always looking at our work through the lens of the social determinants of health, but set by and led by the people that we're serving, not from an academic lens of what the determinants are. Next. So these were just some examples of what that looked like. And Nasma, I don't know if you want to speak to this part of it.
Yeah, for sure. So we thought it would be great to kind of give some concrete examples of like specific supports that community ambassadors provided in their communities that all, as you can see, revolve around social determinants of health, which look very diverse depending on the different communities that you're working with, because it was different community health centers all across Ontario, which all have different focuses. And so there's a wide range of wraparound supports, and examples of that could be in terms of their neighborhood and environment, sharing information about like local services and supports based on community member concerns that are brought to the community ambassadors' attention. In terms of healthcare, a big one was providing accurate information about COVID-19 and other health information, but also having conversations with these community members themselves in terms of understanding, like, what are your priorities with COVID-19 vaccines? Like, do you have any concerns? Do you have any questions that I can address or talk to kind of build that trusting relationship with the community member in order to then give them information about COVID-19, because we know a lot of communities definitely had mistrust when there was vaccines coming out, and for good reason too, based on a lot of histories and presence of medical violence. So definitely building that trustworthy relationship with community members is a big part of what community ambassadors did do. Also in terms of like health education, so hosting town halls and health education events to kind of also build bridges between the community ambassadors and their communities and get to see them and provide educational resources, and also attach it to like food and fun and games and music. So that was also another thing that community ambassadors supported with. And also in terms of the social and community context, they did a lot of providing culturally informative and linguistically inclusive care. So we know that sometimes there's language barriers in the community that community members face. And because of that, there could be like mistrust or perhaps like knowledge kind of lost in between. So community ambassadors really helped bridge that gap there. And also in terms of the economic stability side, we know that community ambassadors were a great referral point for referring community members to different financial and employment services that really supported them with any financial needs or concerns or questions that they have, because it could be a very daunting process, sometimes having to go through like long processes to get support. So community ambassadors kind of helped translate in that sense, and supported community members with that. And that is a couple of examples of the wide range of services that community ambassadors did do. And of course, we're not mentioning everything because that would take hours, but just thought I would pinpoint a couple. And we can go next. Yeah, so again, just kind of emphasizing the work of community ambassadors themselves. So two main themes that they emphasized when we talked to community ambassadors were their effective care and then the trust that they build, which I talked about a little bit previously. So yeah, like in terms of how they deliver this effective and culturally informative care, we actually have some quotes from community ambassadors themselves in terms of how they build a strong sense of community and trust with their community ambassadors. And so, for example, one community ambassador said, we validate and listen to people in order to understand their needs and priorities, to hear where they're at and what's in the way of moving forward. So really just opening that conversation with them and just saying like, what's going on currently? What are you worried about? Instead of just like giving them health information and saying, here, this is what you should do, because that's where there can like become a gap of, you know, trust. Also, one community ambassador said that we walk with empathy no matter what, which is a really big and crucial point. And they said we are patient and we give people time that they cannot find in other places. We boost people up, reminding them that they're doing well. So really, again, emphasizing like the social and emotional support that they also provide when they're doing referral services, and how there's a theme of like patience and understanding and really like holding space for the community members to kind of talk about things that are concerning them or questions that they might have. Whereas in other healthcare settings, they might feel a bit rushed or a bit like ignored. So that's really where community health ambassadors help kind of bridge that gap. And then in terms of the providing of effective care, one community ambassador said, we support families to access support services that are tailored to their specific dynamics and unique needs. So yeah, these conversations, again, like when you have like more casual conversations with community members, it allows for them to kind of understand like what is the unique situation that this person is involved in. And based on their influx of knowledge about the different programs and community services in that area, community ambassadors are able to kind of connect them with very relevant and tailored services, which is great. And then there's also a follow-up piece that community ambassadors do to ensure that the community member that they've referred to a service has been successful in actually accessing that resource or service that they're seeking. And that also helps kind of build further trust and understanding that, okay, this person is here for me and they are really care about like what has happened and where I've went with this information that they've provided me. And that also helps kind of extend that relationship and build that trust for community members to know that they can really come back to these ambassadors for other questions or concerns that they might have. And yeah, we can go to the next slide. And so in terms of this core competencies slide, this is actually a figurine that was developed at an event that we hosted with multiple community ambassadors collaborating with us. And so the main question that kind of prompted this activity was, like, what unique skills do you possess as a community ambassador that makes a difference in the work that you do? Like, when you think of your role as a community ambassador and your sort of superpower, what do you think of? And so this persona was made in collaboration with a lot of community ambassadors across Ontario, and they all gave such great ideas that really reflect the roles that they do. So for example, facilitating access, really listening, discussing strengths and options for individuals, providing assistance, being friendly, being full of compassion and empathy, and having patience, and celebrating the wins and opportunities for community members, providing resources. So, you know, we have a vaccination appointments here, which is a big one as well that they focused on, and just being out in the community, being inclusive and passionate about the roles that they're doing, the support that they're giving. And yeah, educating, engaging, and validating the experience of different community members. So yeah, I think this is definitely when they say a picture speaks 1,000 words, I think this one definitely speaks to that quote itself. So yeah, we can go next. Okay, and so now we're going to kind of talk about how our community ambassadors uniquely positioned to be doing this work. And I will hand that off to you, Lydia-Joi.
Next slide, but I also wanted to see if there's any questions. I'm seeing a lot of feedback on the image. I really love that image also. I don't know if, I'm curious if other people in regions outside of who we were with, if they use similar programs. Or, you know, is that why, does this resonate with you, just what they're doing? Do your ambassadors or your peer workers do similar? Like, even if you want to drop it in the chat, I'm just curious if this is also something that helped you through in the work that you're doing also. This was one of the most like rewarding parts of what we did, was supporting the ambassadors and just learning from them. So
I have a quick question. Were the community ambassadors like employed by
They
you?
were.
Like, were they being paid? Oh, that's
So
amazing.
they were employed by each lead agency. And so what our support for them was that we would do training or have a community of practice so that they could learn from one another. But they were employed, absolutely. That's part of our equity strategy. I know a lot of places
I
have
love
volunteers.
it. Yeah.
But yes, they were employed, and that was part of the funding for high priority community strategies. Yeah. So yeah, if you want to go, I think it's 2, 4, 1, next one. So this is just us kind of saying, interestingly, what happens next? Like for some of our agencies, this is how they already did their work. A lot of these strategies we're not inventing new. They did have community ambassadors that facilitated other projects, but we're really looking at, how does this become a normal in the healthcare system? How is it not seen as like extra help or something that was used in a pandemic? We're really looking at how this can be valued and that community ambassadors and the work that they do can be seen as expertise and all of those things that we said, like, that empathy is just as important as some of the diagnostics and the other things that we think of as medical help. But I think that some of the things that they've done are part of this holistic care. And we really, I know especially at Health Commons, we're really looking to advocate for, how are these type of workers really, really, really important in the system to integrate everything together. There was such a level of, we know that all our healthcare workers have care and have our own area, but I think that the part of the gift that they gave was time, like that their job was to actually sit with people and to actually connect with people. It wasn't an extra part of it. It was like, can you please care for those in your community? And I think it was really beautiful to see, and it helped bring a cohesiveness to the whole system, especially when we were in a time of crisis, that you have somebody that their job is just to say like, hey, are you okay? And can I listen to you? And can I listen to what you need as a whole person, not just for the one thing that you came in, whether that's, a vaccine or something really specific. The fact that this was what their job was to figure out personalized care plans. I think it's something that we're really hoping becomes integrated and a normal part of this type of work going forward. So next slide, please. So I think we just wanted to highlight that's kind of the backbone of what we supported and what was across the system. But we want to look at 2 examples from both of our partners here of what it looks like kind of in detail. Sometimes we have these conversations really high level and we're talking about, oh, these great people, what do they do? So we have 2 examples of what does it look like in reality, and hopefully some models for those of you who are here who either have similar type of work or would want to do it going forward, that we can show you how like this was mobilized by these lead agencies and executed by these community ambassadors and others with their support. And so what does it look like when we all work together to be able to like address needs very quickly within the community? So next.
Okay, I think this is me.
Yes.
So one of our innovative approaches during COVID and beyond was our community health and wellness fairs. So this was done in collaboration with our local public unit, Region Appeal, Roots Community Services, Wellfort, which is the agency I represent, and is a community health center, LAMP, East Mississauga, which is also a community health center in another region of Peel, Ontario Health, Moyo Health and Community Services, Canadian Mental Health Association of Peel, Black Health Alliance, Black Physicians Association of Ontario. All of these folks came together and hosted several community wellness fairs for the Black, African, and Caribbean communities. And we continue to host these wellness fairs throughout Peel. There were several things that ignited this amazing collaboration. We initially came together through, and I think Lydia-Joi talked to you a little bit about high priority community strategies. We came together initially through that to support the communities hardest hit by COVID, and particularly the Black, African, and Caribbean communities. recognizing that the barriers surrounding COVID and vaccinations, for example, the very valid mistrust of pharmaceuticals and healthcare, this collaboration organized a series of vaccination clinics for the Black African and Caribbean community, which involves staffing the clinic with trusted CHAs, physicians, nurses that represented the Black African and Caribbean community. The CHAs were also a very integral part of these clinics, as they had built trusted relationships with the community and offered additional support and education at some of these clinics. We were very successful at creating a supportive environment, and Lydia-Joi mentioned this, that we had food and music and just trying to create a very supportive and comforting environment. This collaboration also had several community consultations, town halls, combined with the inside knowledge of our CHAs, which helped guide and frame our approach to ensuring that the Black African and Caribbean communities were not left behind, and that they had all the information that they needed to make informed decisions around how to protect themselves from COVID. One of the key strategies for successfully reaching the Black African and Caribbean communities is that the collaborative recognized that our local public health unit couldn't just do this work or lead this work on their own, that community agencies who were closely connected to the people and were trusted needed to lead this work. So organizations like Roots Community Services, which is a B3 agency, was front and center at this initiative. Although it was collaborative, they had built a lot of trust within the community and needed to be front and center for this initiative. Recognizing that building trust also takes time, that folks were also experiencing COVID fatigue, and that the Black African and Caribbean communities also face other health concerns that were exacerbated by COVID. We came together to provide these our community health, wellness fairs. These fairs incorporated education around COVID and treatment, as well as vaccination services. But more importantly, agencies within the collaborative provided other health information and services like diabetes testing and blood pressure testing and health and wellness education focused on the Black African and Caribbean communities. So through time, these health fairs evolved to include a focus on preventative care, like cancer screening, but also involved local Black vendors who provided more alternatives to health and well-being. So things like massage therapy and naturopathic medicine was also incorporated into the fairs. So these collaborative health fairs have been very well received within the community and very well attended by the community, and have been successfully rolled out throughout the region of Peel. And we're very proud of that success. You can go to the next slide. So what was unique about this health fair? I did touch on some of these things, but what was unique, or the uniqueness, is from several different several different reasons for this being so unique. One is representation. All of the providers, educators, and organizations represented the BAC community, and each of these organizations that participated in the fair provided programs and services to the Black African and Caribbean communities in Peel. Also, the CHAs represented the Black African and Caribbean communities. The fair also included culturally informed programming, so the education and services that were provided were tailored to the Black African and Caribbean community. We had blood pressure checks provided by students from Black Physicians Association of Ontario. We had organizations like Olive Branch of Hope, an organization supporting Black women with breast cancer. They provided education and resources that supported the importance of screening. There were also local community organizations providing information and products specifically for Black skin and hair health. So as well as many other Black serving organizations, this was a well-rounded, very deliberate focus on ensuring that it was culturally informed and specific to the Black community. Intersectoral collaboration is also a unique feature of our health fair. So the fair involved a collaboration of community health centers like Wellfort and East Mississauga, but other health services and social services across the region appeal, who all focused on Black health programming. This feature allowed us to utilize the strengths of each of the organizations to ensure equity and quality care for this particular community. Next slide, please. Thank you. So as we moved into the recovery phase of our high priority community strategy, we wanted to shift our focus to understanding how barriers such as systemic, cultural, financial, and social can impede people's ability to receive quality care, specifically care related to diabetes management and preventative cancer screening. So we decided to kick off our high priority community strategy recovery phase by organizing a series of focus groups to hear from the community about their lived experiences with accessing diabetes care and preventative cancer care. So this word cloud depiction is of some of the more salient themes that were highlighted by the participants in the focus group. So some of the key themes were around improving accessibility, culturally and linguistically appropriate resources, combating stigma, and a holistic approach to care. So utilizing this information, we created some culturally appropriate resources that addressed some of the stigma and fear and other barriers to accessing cervical and breast screening, as well as diabetes care. And next slide, please. Also, as a part of addressing the theme of accessibility, we partnered with CMHA Peel and Family Services of Peel to provide diabetes testing, cancer screening services, and education within the community, utilizing a health van, which we called Wellfort on Wheels. So we recognize that we wouldn't have had this lineup of folks wanting to do their PAPs on a van, and that people had reservations about this. So we did provide van tours where folks can meet the staff and tour the van to help increase their comfort level. The van has been at many different places throughout the community centers, residential buildings, churches, and shelters. We have found that the cervical screenings were more successful at shelters, like smaller residential settings. And we found that because it gave us an opportunity to provide education just around screening and an opportunity for supportive discussion with other residents, with the clinicians, some question and answers, and all of those things kind of really helped just in terms of screening uptake. Next slide, please. So slide 23. So Wellfort's also conducted an evaluation of our community health ambassador model. And this was done through our immunization partnership fund that we had received. And we had used that model in this particular project. And so the findings revealed that the CHA model had significant impact on fostering partnerships. So because CHAs were out in the community, they were developing partnerships with local organizations, faith institutions, schools, grocery stores, anywhere that they knew folks would be. They were connecting with these organizations and companies and really just trying to create some partnerships so that we can do this work together. But also worked with existing partners in new ways, right? Like, so, some of us had already had some partnerships with, for example, the library, public library, where we might have them come in and talk about some of their services and so forth. But with this, with COVID, we thought it would be a great opportunity for us to have a resource table at the public library. So we had CHAs in these various places trying to connect and continuing the conversations with the community members. The model has also impacted on diverse, inclusive, culturally appropriate education and care. So CHAs were able to reach a wide variety of clients, such as clients who spoke limited English and were new to the country. Most of the CHAs were able to speak multiple languages and walk the client through, getting a vaccine, getting screened, testing, processes, and that could be done in the respective language. There was also significant impact on accessibility. So the CHAs helped to arrange transportation to clinics, like vaccine clinics, PAP clinics, and supported with booking appointments for folks who may had challenges booking, using technology, going on the website. So they were really instrumental in ensuring that community members were supported in that. The CHAs also created lasting community connections. So, it has been very effective for getting information out into the community and giving people opportunities to have conversations and ask questions that they might not otherwise ask their provider or primary care provider. The model had an impact on empowering marginalized communities. So the CHA model encourages clients to take action regarding their own health. So clients often told CHAs that they followed through with booking immunizations or testing and screening appointments after having that initial conversation with the CHA about it. And then last but not least, the CHA model had an impact on building trust. And we talked a little bit about that earlier in the presentation, and also in creating system navigation pathways. So CHAs addressed the heightened trust deficit at the beginning of the COVID-19 pandemic. One of our partner organizations said that they found that the CHAs emerged as champions whom people could trust and come to when they needed information or support. So just an amazing model that, throughout the different transitions, our response for COVID and our recovery afterwards, just that ability to be able to utilize that model throughout all of that was really helped organizations like health organizations and organizations, social service organizations to bridge that gap between the provider and the community. Next slide. That's CMHA.
So as you know, key aspects of the CHA model addresses partnerships, inclusivity, creating lasting community connections, and system navigation pathways. So in the height of the pandemic, this was one of the ways, a request was made by our Muslim community for a vax bus on Fridays to accommodate Friday prayers. According to that community, Friday prayers are very well attended. But the challenge with that request was that Fridays is reserved for sanitizing the vax buses. So they were unavailable. So after consulting with the CHAs about how to best design a culturally informative way of delivering vaccine to this community, we went ahead and we strongly advocated. We came up with a lot of blocks, again, system blocks that said, we can't do this. This is what we do with the buses on Fridays. And then we spoke to them as part of that advocacy. You're speaking to community members saying they don't want to be vaccinated, but the barrier here really is access. So we did a lot of strong advocacy to bring the Vax Bus to ISNA, to connect members, as well as provide an opportunity for the Muslim community to be vaccinated, right? So the turnout and vaccines delivered was extraordinary, which speaks to accessibility and system navigation, as well as meeting people where they're at. Next slide, please. So when we talk about situating healthcare initiatives in the community, we've got to begin by building trust with community members. And how do we do that? We do that by creating safe spaces and inclusive spaces that are culturally and linguistically relevant, which helps to shift the power and balance in that community. So our CHAs, as you've heard before, are members of the community. They serve and approach the community with that lived experience lens, right, of understanding the complexity of the various systems and what gaps exist. You know, there's a slogan that was first invoked in South Africa by a disability rights movement, which says, "Nothing about us without us." And this slogan is generally, it's a call for action to help overcome systemic oppression and to empower communities to take control over decisions affecting their lives. So this is done through community-based participatory engagement. As mentioned earlier by my colleague Marsha, Wellfort utilized for the community, from the community approach when they conducted the focus groups. And some of the key findings included the need to improve access, to provide culturally and linguistically appropriate resources, and to combat stigma, to name a few. So these outcomes resulted in multi-sector collaborations, which also allowed us to purposefully draw on the knowledge, resources, and expertise of other high priority agencies, as well as health commons, to jointly elevate support in our communities. Next slide, please. I think that is Nasma.
We're actually just in cognizance of time. We actually wanted to just pause here to see if there was any questions, like especially about some of the programs that we just heard. We just want to really give an opportunity to talk about, to share with those who are here, if they're similar to what you have, if there's other resources that we can provide, or any questions at all.
We can give a couple of seconds. I think maybe people are thinking. They're typing.
Then feel free to come off mute. I've been taking a look at the chat. Pap on a van being catchy is not so much a question, but that is there. I'm not seeing any other questions at this point. So again, feel free to come off mute or to go into the chat and type question in all caps and ask your question in the chat for our presenters.
I think just as people are thinking about it, what we were wrapping up here kind of with our last couple slides that we're just truncating a little bit for the sake of time is just, you know, what you've seen examples of here, you know, especially from both of our partners here. It's not that they weren't doing these things before, but being able to pool our resources together. And as you heard, so many examples of working with partners in community and system partners and having this backbone support just made the world of difference. I'm sure like even the PAP on event, we probably would have done elements of that before, but having the resources to scale up and having the partners to do it made such a difference. And I think, you know, what we're really looking at while we're in this recovery phase is how do we keep these lessons going? How are they not seen as a special project? How are they seen as, you know, the way forward? So both with community ambassadors, with these groups that aren't working in silos or competing for resources, but instead really saying, hey, this is the area that we're strong in. How do we do this together? So when we have things like community fairs, when we have all of these different examples, when community asks you for specific timing and et cetera, we don't have to say, hey, you know, there's these limitations. We actually have ways to support each other. So I think, you know, all of what we've shown today or how we were able to do this, and we're just a small part of a bigger collective. And we're just encouraging that similar practices are built and similar learnings across the whole network or in the areas that you're in also. I think that's it for us today. I didn't get to Vogue one last time, Kim, so we can go to like the last slide if you wanted to.
I'm happy you were able to use that signal at least once. And this is just a quote from a community ambassador on how they build strong, trusting relationships. And from there, they take that trust and act as a resource to their community. And a community member actually told them, "You are my Google," which shows the level of trust and reliability there in the community ambassadors.
I'm going to start the process of unpinning our presenters so that we can see everybody in the room. Sometimes it's a little bit easier if there's questions to be able to ask that way. So just one moment as I do this. Okay.
Yeah, we'll give everyone a couple of seconds or minutes if you're thinking or would like to type. But if not, then thank you so much for coming to our presentation, and we will be sharing this back with you all. So for those of you who liked the personas that we developed, we will have that to you as well.
Seeing some good feedback here in the chat. And just noting, especially Allison H, at our agency, we use a rising strong philosophy, which really falls in line with part of your framework here. I will say I'm very thankful to have been part of this presentation as a moderator. As I mentioned earlier, I'm a quality improvement coach, and it sounds like this is a really important aspect of working on quality improvement in your area. So access to care, equitable care. Very exciting to hear about your work in this area.
Thank you. Thank you so much, everyone. We appreciate it. And I think we had a slide on our socials as well, Kim, if you go all the way to the end. I think some of the last slide. Yeah, we're all on Instagram and they're hyperlinked into the slide as well. So you'll have access to that once it's shared back. But thank you. We appreciate your feedback.
And I'll just draw everyone's attention to the session page is where you will be able to go to be able to fill out the evaluation for all of the sessions today. So click on the agenda, click on this session, and you'll be able to choose the evaluation from that section. As we're wrapping up, thank you very much to our presenters today.
No problem. Thank you, Kim and Lucy.
Thank you.
Our pleasure. That was wonderful. It's always wonderful to hear about communities supporting, you know, folks in their communities. And I love the ambassadors. It's such a great, fabulous, fabulous. And I'm so glad they're getting paid.
Yes.
so much of this work relies on volunteers, right? Which is wonderful, but not sustainable necessarily. So it's fabulous that you were able to, you know, get people jobs. It's huge, especially in the middle of a pandemic.
Okay, it's 4 o'clock now. So we will be having the closing remarks for day one. back in the plenary room. So we'll see you there.
Thank you,
everyone, for your time.
Thank you.
Bye-bye.
Have a great day.